I have said for 17 years, I'm not anti-vaccine. There's no vaccine that is, safe and effective. Vaccines are definitely linked to autism, for sure. Would I take a measles vaccine? No. I have never told the public avoid vaccination.
I see somebody on a hiking trail with carrying a little baby, and I say to them, better not get him vaccinated. Maybe he will save that child.
COVID-19 is targeted to attack Caucasians and black people. We should have good science. We should have the same kind of testing, placebo-controlled trials that we have for every other medication.
We are back with The Big Deal. I'm Errol Louis. The nomination of Robert F. Kennedy Jr. as Secretary of the Department of Health and Human Services has raised alarm among some public health officials. That's because if confirmed by the Senate, RFK Jr., a longtime vaccine skeptic and former presidential candidate, would oversee more than 80,000 employees across 13 agencies that regulate drug, vaccine, and food safety, as well as medical research. But over just the past few years, Kennedy, who is the nephew of President John F. Kennedy, has used his famous name to spread false information about vaccines and condemn the nation's health agencies. Take a look.
I have said for 17 years, I'm not anti-vaccine. There's no vaccine that is, safe and effective. Vaccines are definitely linked to autism, for sure. Would I take a measles vaccine? No. I have never told the public avoid vaccination.
I see somebody on a hiking trail with carrying a little baby, and I say to them, better not get him vaccinated. Maybe he will save that child.
COVID-19 is targeted to attack Caucasians and black people. We should have good science. We should have the same kind of testing, placebo-controlled trials that we have for every other medication.
Along with Robert F. Kennedy Jr., Trump has filled out the rest of his health team with people who have little to no experience running a large federal bureaucracy. That includes Dr. Mehmet Oz, a former television host, as the head of the Centers for Medicaid and Medicare Services, and Dr. Jay Bhattacharya, a critic of pandemic lockdowns and vaccine mandates, as head of the National Institutes of Health. And with this team, Robert F. Kennedy Jr. has pledged to, quote, make America healthy again. So what will that look like? Joining me now to break it all down is Dr. Syra Madad, an epidemiologist at the Harvard Kennedy School. Dr. Madad recently published an article called What Robert F. Kennedy's Appointment Means for Public Health. And so, Dr. Madad, Mr. Kennedy has said that he won't get rid of vaccines, but as we have heard, he's also said that no vaccine is safe and effective, and he called the COVID vaccine, quote, the deadliest vaccine ever made. So if he's confirmed, what should we expect to see from the federal government?
Well, I mean, I'll be clear. RFK has spent decades and decades undermining science, opposing evidence-based public health practice, eroding science and trust. And so, if elected, I think there's going to be both direct and indirect consequences to the health of all Americans. Directly, for example, he will have control over multiple different public health agencies, as you stated in your introduction, FDA, CDC, NIH, all of these public health agencies shape the lives of Americans as it influences our health. Everything from, food that we put on our table, to the drugs that are on the shelves, to so much more. So when we talk about directly how he can impact, public health and health policy, he can, for example, choose individuals that are vaccine skeptics on some of these key advisory boards that we have at the FDA and the CDC that help advise on different types of vaccines and the public health recommendation. Indirectly, one of the ways that he can influence, the health of Americans is by sowing mis and disinformation, casting doubt, cherry picking data, and essentially what this can do is, decrease our vaccination rates across the country. And already, we're already seeing surging numbers of different vaccine preventable illnesses. Let's just say measles, for example. We're clocking in, unfortunately, almost 300 measles cases just this year compared to 59 last year. And most recently, we're seeing a pretty high increase of whooping cough, another vaccine preventable illness. And so, there's going to be direct and indirect consequences to some of these health policy implications and just the rhetoric that he's potentially going to be sharing across the national platform.
Yeah, there's a lot of concern about vaccines. I wanted to also, though, talk about other forms of government regulation. Mr. Kennedy is a vocal proponent of raw milk, which the FDA and the CDC have both strongly advised against because raw milk can contain dangerous bacteria and also viruses. And this is coming at a time when medical experts are also warning about a possible bird flu outbreak among humans. If he becomes the health secretary, could he change FDA policy around these kind of things?
He can certainly influence the FDA's policy and really slow down any countermeasures, that may be in the pipeline, whether it's vaccines or the like. And just to hone in on the point of why it's so important not to drink raw unpasteurized milk, as we talk about bird flu, we've already seen 58 human cases in the United States. These are sporadic human cases. Almost all of them have been linked to exposure to infected poultry or dairy cattle. And in California, there's already been a broad recall of raw unpasteurized milk because they've detected bird flu in milk. And we know that this can certainly cause pretty severe illness and disease in the animal models that we've seen it in. So certainly it could apply to humans. So this is dangerous. And we know that drinking raw unpasteurized milk is not just bad because of H5N1, which is the current threat, but you can get so many other infectious diseases from salmonella, listeria, and other types. And so the commonality here is that he's toting, non-evidence-based science, and he's actually, promoting dangerous practices that could certainly harm many individuals around the nation.
Well, yeah, and there's a cumulative effect of this, right? I mean, Mr. Kennedy's nomination comes at a time when confidence in scientists to act in the public's best interest has not recovered from pre-pandemic levels. Why is that, and what are public health officials supposed to do to gain back the trust of the public?
That's an excellent question. And unfortunately, we've exited the pandemic with less trust in science than we did entering it. And that's very telling for many different reasons. And that's not to say that, public health agencies got everything right. There are certainly areas for improvement. There are certainly many things that we've learned that, we need to correct upon moving forward. But these are, golden standard institutions with career scientists who, really have spent decades and decades of their life understanding the science, interpreting the data. So that way general Americans don't have to sift through pages of data to understand, well, what's best for me? Should I get vaccinated? Should I not eat this? Should I, take this medication and the like? And so, there's this public trust that is so important when we talk about different public health emergencies. And so there's so many things that we need to continue to improve on, and they're happening right now behind the scenes. But when you're casting doubt on these career scientists, as he's already mentioned, he wants to get rid of and clear out many of these agencies. Who else are you going to have that's going to support, the Americans as we look at what's best for our health? And we have an epidemic of so many different issues, obesity certainly being one, chronic illnesses, infectious disease. And so we need to make sure we're surrounding ourselves with individuals that have the knowledge and have the data that they can go through to share good public health policy.
Okay, real cause for concern. Thank you very much, Dr. Madad.
Thank you.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.